6:52, Big 550 KTRS. You got about 10 days left to sign up for the Affordable Care Act. What does that mean exactly? Does that mean 10 days before the world implodes and we fall into a big black hole because of the second year of the Affordable Care Act, otherwise known as Obamacare? Bill Corr is with us, U.S. Department of Health and Human Services Deputy Director. Bill, thanks for joining us here on KTRS in St. Louis. Bill, are you there?
Yes, I am. Good morning, McGraw.
Good morning. Good to hear you. We're here to talk about two different states, two very different situations, one in Illinois, one in Missouri, because one has expanded Medicaid and the other one hasn't. First, let's start with Illinois. How are the numbers year two of the Affordable Care Act in the state of Illinois?
McGraw, things are going quite well in Illinois. We've had a 141% increase in individuals enrolling or re-enrolling. We're now seeing about 307,000 Illinoisans have signed up. Last year we had 217,000. So we've got good growth, and there's a reason, is that people can get quality health insurance at an affordable price. 78% of those in Illinois who have signed up were eligible for a tax credit to cover a portion of the cost of private health insurance, and they had access to, on average, 10 health plans to choose from. So this is a great opportunity for people who do not have health insurance coverage to sign up to get quality coverage at an affordable price.
And they do that through healthcare.gov, right?
There are several ways. We want to make this as easy as possible because we understand that signing up for health insurance is complicated. They can go to healthcare.gov. They also can call, your listeners can call our 24-hour, 7-day-a-week call center at 1-800-318-2596. We've got thousands of call center representatives that are available and ready to talk someone through all of the choices that they need to consider.
Okay, there are 307,000 people in the state of Illinois that have health insurance through the Affordable Care Act. How many of those are through expansion of Medicaid?
This does not include the people who are eligible for Medicaid. These are just people who are signing up for private health insurance through the healthcare marketplace.
Okay, got it. Now, how many of these 307,000 actually pay? Because the rumors were that these people were going to sign up and never pay.
Well, these are people who have chosen a plan or re-enrolled from last year. Last year, we had 217,000 who signed up and paid their premiums and had health insurance this last year. So of the 307,000, many of those are new, and they will have to pay their premiums in order to get their insurance.
A lot of people said that it was terrible insurance, that you paid, you signed up, you paid, and then no doctor was going to then service that account.
Well, as we look at the number of plans that are available, as we look at the providers that are a part of those plans, and it's possible for someone to see who the providers are that are working with each of these health plans, that's the obligation of the health insurance company to make those providers available to those who've signed up for it. So there are occasional stories you hear about someone not being able to find a doctor, but if they've paid for health insurance, the state health insurance offices are responsible for licensing those health insurance companies. They're supposed to get that care.
All right. Now, and we're still staying in the state of Illinois. We'll get to Missouri here in a second. Have the prices of insurance gone up or gone down in the state of Missouri for overall health insurance?
Well, what I can tell you is that 78% are getting tax credits to help them with the cost. I apologize for not knowing exactly what the average premium has done in Illinois, but McGraw, we will get that and get back to you right away. Okay,
fair enough. Now let's go across the river to the state of Missouri. What are you seeing Missouri-wise with the Affordable Care Act?
In Missouri last year, we had 152,000 who signed up for health insurance and had health insurance, and we've seen a 49% increase. We're roughly now about 228,000 citizens in Missouri have signed up for health insurance or re-enrolled from last year.
How many of those 230,000 get some type of federal subsidy?
88% are getting some sort of a tax credit that will cover a portion of the cost of their premiums.
There aren't as many plan options in Missouri as there is in Illinois.
That's correct, but on average, there are 7 health insurance plans that are available to people across the state.
The companies have not been forced to sort of change over. Are you expecting that to change the numbers either negatively or positively?
McGraw, we're relying upon competition. The private insurance companies want to enroll new people, and what we're seeing is a growth in the number of health plans all across the country that are being offered. The health insurance industry has an opportunity to provide a quality product and to get people to enroll. And so we think the pressures are all on the health insurance companies to do a better job of serving their customers.
Do we have any idea how many plans in Illinois and Missouri were not deemed appropriate and therefore the people were not allowed to re-enroll in those plans?
Well, this is a private competitive marketplace, so those insurance companies that choose to offer services can, and those that don't want to can pull out. So
no, I understand that, but there were a number of people whose plans were canceled because they didn't meet the federal guidelines. Do we have any idea how many plans, overall number of people whose plans were canceled who had to go out and find new plans?
I don't have that for you, but what we do know is that we've got with the number of health plans being offered is growing, and so individuals have a better choice of health insurance plans to choose from. And that's the most important thing to us, is we want individuals to be able to find quality health insurance that meets their individual or their family needs at an affordable price. And we believe that across both Illinois and Missouri, that's going to be the case.
In Missouri, you said 230,000 people, 228,000 people have signed up through the websites, the phone numbers, and things like that. Is that a net gain? In other words, did 230,000 people sign up, but 400,000 people lose insurance? So it's a negative or a positive? Do you have any idea how many more people overall are insured in these states?
Last year in Missouri, through healthcare.gov and through our call centers, 152,000 individuals signed up for health insurance and paid their premiums and were enrolled. The 227,000 figure so far during this open enrollment period is the number of people who have re-enrolled or new people who have signed up for the first time.
Yeah. Okay. And then the call centers are still open. When does that window close?
The open enrollment ends February 15th, this Sunday.
Okay.
The call center will continue to be open to answer questions. It'll be open year-round. But we expect there'll be people who'll be waiting till the last minute on February 15th, and we're going to make sure that anyone who wants to get health insurance that reaches out to us before our deadline, we're going to serve them and be in touch with them so that they can have the opportunity to get quality health insurance.
Bill Core, U.S. Department of Health and Human Services Deputy Director. Bill, thanks for checking in.
My pleasure, McGraw. Thank you.
731 here, Big 550, KT.